Hi everyone, I'm GREYMOND. I'm an OCD recovery coach with more than 10 years of experience helping people recover from OCD. Prior to that, I had severe OCD myself that I fully recovered from, and as do my clients. So if you wonder, can you fully recover from OCD? Absolutely, yes, you can. Today, we're continuing to answer questions about OCD recovery. This is the Q&A continuing from yesterday. First question is, Hi Ali, I have severe OCD about depression and suicide. I feel like I don't want anything. I don't want to go anywhere. My therapist told me that this is depression and gave me antidepressants. My OCD tells me that I need to lay down and watch the wall. I'm so scared. Please tell me this is normal, that I feel this way. Does it go away? Do I die from this state of feeling? Thank you for the answer. So, the fact that you're ruminating about it, you're obsessing, you're anxious about it, um, this shows that this is OCD. And being anxious about it is kind of an iffy term because sometimes you might feel anxious, but sometimes you might feel just numb and you actually don't feel anxiety, but you then start to feel anxiety about not feeling anxiety, right? Or feeling anxiety, feeling depressed, and then worrying about feeling depressed. So, first, the feeling of depression comes in, and then you're worrying about that feeling of depression. And then, same with fearing suicide. You have to look at all these things as classic OCD themes. I promise you 100% that they're just classic OCD things. You have to disregard the thought itself, the feelings that go along with it, whether you get anxiety or not. Um, just look at it all as it's all OCD. It doesn't matter. Let the thoughts come in however they're going to come in. And we're choosing to disregard. Just over and over making the brave choice to disregard. I promise you, if you do this, you will start to feel better. But yes, I see this very commonly. You will not die from this. It's just a fear of suicide, fear of depression. Again, classic. So you have to take steps to this regard. Try to track the time, how much time you're spending on ruminating. Don't Google anything. Um, it's and try to live life as if everything is okay. I get that you'll be faking it, but try to live life as if everything is okay. Going out, not allowing yourself to stay in bed, not allowing yourself to stay in the room, kind of thing, because that just drives the rumination further. Also. Don't get too much reassure. I get sometimes that you want to express how you feel to others, and of course that's valid. But if it becomes reassurance behavior or protective behavior, and it's repetitive, right? The repetition of it over and over tells you that that's OCD. Next question is, Hi Ali, my English isn't that good, so there might be some grammatical errors. I had problem with numbers for 2 years now, especially with number six. If I'm in touch with something I feel is bad, like if a store, in the store, I pay for my shopping, but sometimes feels bad about it. I have to wash my hands and everything. Uh, the bad number has been in touch with. Also, my credit card. I suffer from bad anxiety, like if I were constantly under the influence of it until I do something about it. So the person's saying that they feel like they're always under the influence of this bad number until they do the compulsion. Um, those are just some of the examples. I'm also counting letters in words. I don't want to do or purchase things if the date is wrong. There's something also compulsive things. Uh, I do have a medication, a sertraline, but I hate the side effects and I won't be increasing the dose even when doctors say I should. It's getting pretty hard because I can't run from the numbers, and we are surrounded by them everywhere. So I'm asking if there's some good recovery technique to start practice. So, what I would do, and I see this a lot, what I would do is start practicing this number in situations which are not very important to you. If you have kind of also other numbers that are maybe a little less frightening, but also kind of frightening, maybe start with those and start with situations that are like, well, say you bought something, but it's not that important, kind of thing. Because you need to find the way to start approaching this number. or maybe allowing yourself to look at the number from far away or something like that. Just basically just getting your feet wet in the water without fully jumping into the pool, little by little. Allow yourself to not avoid, but at the same time, kind of not to the point where your anxiety goes over, I would say, 7 out of 10, even 6 out of 10. So just small doable exposure a few times a day, every single day. And as you feel more comfortable, increase. It has to be a very much an accountability process where every day, like a job, no matter what, you're doing this. And if you do this time after time, you will see that it won't feel as anxiety producing anymore. It's just a situation of step by step, You do this, I promise you, you will recover. I have to make the video a little bit shorter today due to sessions. I will be back tomorrow with another video. Thank you for watching. I'll see you tomorrow.